Yeah, so measurable residual disease is it's a very important endpoint in blood cancers, and what it refers to really are very, very small amounts of disease that can be detected by various methods, but are not easily clinically detected or detected radiographically usually. So there are lots of methods that can be used to detect MRD, such as flow cytometry, PCR, next generation sequencing, and it is becoming increasingly important in lymphoma and CLL as a way of measuring disease at various time points. In particular, at the end of therapy. So recently, the NCCN actually included measuring MRD at the end of therapy for diffuse large B-cell lymphoma in patients who have a positive PET scan. Ways of looking at MRD include performing, for example, flow cytometry, PCR testing, next generation sequencing. There's really a lot of interest in liquid biopsies and looking at, for example, a particular sequence on the surface immunoglobulin. That's the VDJ sequence, and this is part of the lymphoma, and it can be detected in the blood. So what happens is that at diagnosis, you can take some of the diagnostic tissue, and it can be tested for this VDJ sequence, and then this same VDJ sequence can be detected in the blood, and that can be very useful at the end of treatment and in follow-up, because if you find that same sequence in the blood, that indicates that there are circulating tumor cells present, and frequently these can be detected where PET scanning and other imaging is not showing any abnormalities, or on the other side of things, PET scanning and imaging can show abnormalities which do not represent lymphoma, and then the MRD test, or looking, for example, at the VDJ sequence in the blood, can show you that there is no residual disease there, so the PET scan was incorrect. It totally varies according to the type of lymphoma or CLL when it is most useful to do MRD testing. I can talk a little bit about aggressive lymphoma, because that's the most common type of lymphoma. So for diffuse large B-cell lymphoma, studies have looked at MRD testing at various time points, and I'm talking about people who have a new diagnosis of diffuse large B-cell lymphoma. And we know from studies that if you look at liquid biopsy or MRD testing at the end of treatment and in the middle of treatment, it gives you important prognostic information. This has been looked at in retrospective studies, and a lot of prospective studies are evaluating it. But in retrospective studies, we know that if you look at MRD in the middle of treatment, those patients who are MRD negative, and these are patients with diffuse large B-cell lymphoma who receive standard therapy, they have a better outcome than patients who are MRD positive in the middle of treatment. And then we know that patients who are MRD negative at the end of treatment also have a better outcome than patients who are MRD positive. We typically use PET scanning to assess disease status in the middle of treatment and at the end of treatment for diffuse large B-cell lymphoma. And in most cases, PET scanning is very accurate and very helpful, but it's not perfect. And there is a significant false positive rate with PET scanning. And that's, I think, where MRD testing at the end of therapy looks like it can be very helpful. There are a number of different companies who have these MRD assays, and depending on the exact type of test, their levels of detection of tumor cells differ. For example, we have MRD testing, such as something called CAP-seq and phase-seq, and these have different levels of detection. And what happens in the clinic is that we take a sample. We already have to have taken a sample of the initial tumor to have identified the sequence that can be tested for. We take a sample, we send it off to the lab where the testing is done, and then the results come back to us. And that usually takes, I would say, 7 to 10 days approximately. I think, though, as we do more testing, we have more companies and more assays, that turnover time will get shorter and shorter. Yeah, that's a really good question, and we are still, I think, learning and investigating what a positive and negative result means. I'll focus a little bit on diffuse large B-cell lymphoma again. So we know that a positive result at the end of therapy is associated with a worse outcome than having a negative result, and we know that a positive result in the middle of therapy is also associated with a worse outcome. What we don't know is what to do if you have a positive result at the end of therapy. We don't know if it means that you need to get more treatment, if it can be observed and repeated again in a short follow-up time. And this is if imaging is negative and clinically there's no evidence of disease. There are studies that are ongoing looking at interventions for patients who have a positive result at the end of therapy, again with diffuse large B-cell lymphoma. Again, we're talking about diffuse large B-cell lymphoma. This of course can happen where everything is negative at the end of treatment, and then in follow-up, an MRD test comes back positive. When that happens, we very closely look at other parameters. So we look at the clinical picture, PET imaging. We try to find any evidence of disease with other assays. If we don't, we usually interpret that result quite cautiously. You can have false positive results with MRD. So typically in follow-up, if somebody has a positive MRD test and no other evidence of disease, what we typically do is repeat that test over a short period of time. And sometimes that test will become negative if it's falsely positive, or in my experience, if there's a positive MRD test, subsequently there will be other tests that will show evidence of disease, and then treatment will be decided based on those more standard parameters that we have a lot more experience using and interpreting. Yeah, so you wait until it's a clinical relapse. So imaging, if imaging detects residual disease, in a lot of cases, people will go ahead and do a biopsy to confirm that disease has come back, and then if it has, treatment will be started. Depending on what the goals are, and depending on how long after treatment this has happened.